Australia experiences its steepest monthly unemployment rate rise on record.
When you have almost 600,000 people exit employment, that is a devastating set of numbers.
Service New South Wales is hit by cyber attackers who access data in staff emails. After 13 years in jail, questions over planted evidence see a WA man's murder conviction quashed. And the NRL Referees Union lodges a Fair Work complaint over plans to move from 2 match referees to 1. Hello and welcome to ABC News. I'm Kirsten Aiken. More than 590,000 jobs were lost last month as Australia's coronavirus lockdown hit businesses. There are now 6 million people on the JobKeeper scheme and 1.6 million on the JobSeeker unemployment benefit. Our correspondent Philip Williams joins me now. Good afternoon to you, Phil. Question time was today dominated by the expected but nonetheless disturbing jobs figures and the government's handling of the JobKeeper scheme.
Yes, very much so. Of course, the government has said that they expected these bad figures, and they're pretty much in line with predictions from a few weeks ago. And they expressed their sympathies for those that are newly unemployed and on the job seeker arrangement. JobKeeper, of course, is a slightly more contentious, well, a lot more contentious really, because the opposition has said, look, as much as we support JobKeeper, there are a lot of people that have fallen through the cracks. And here's how Anthony Albanese put it to the Prime Minister.
The number of people employed in Australia fell by 600,000 in April. This followed the Prime Minister's decision to deny a wage subsidy to casual workers, arts and entertainment workers and workers in the university and local government sectors. Aren't more Australians out of work today because the Prime Minister deliberately excluded them from the JobKeeper wage subsidy?
The Prime Minister has the call.
No, Mr. Speaker, that's not true. Mr. Speaker, it's disappointing,
Members on my
Mr.
left.
Speaker, that when the Labor Party says they're engaging in a bipartisan effort, it doesn't take long, Mr. Speaker, for the white-handing to begin.
Member for Rankin. Member for Rankin.
It really doesn't take long, Mr. Speaker, because the truth is 6 million Australians are benefiting from a JobKeeper program, Mr. Speaker, that is being shouldered by taxpayers to the tune of more than $20 billion a month, Mr. Speaker. And on top of that, Mr. Speaker, there is the expansion of the JobSeeker program.
That was the Prime Minister in question time. Now everyone is looking forward to the end of the crisis. And it's been revealed cruise companies are already taking bookings for September. The Deputy Chief Medical Officer, Nick Coatsworth, had something to say about that.
Yes, he was asked about that. Was it too early? And, well, you'll hear in a second, but I guess that is the question, because Australians love their cruise ships. We have taken to that industry almost like none others. However, as we've seen, the cruise ships have also been incubators for COVID-19, and that you would expect may have a material effect on those booking for these new cruises. But if companies are taking bookings for cruises scheduled for September, is that too early? Well, here's what the Deputy CMO said.
The health advice is that we've put in a 3-step plan towards recovery. Booking cruise ship holidays don't appear in those 3 steps, and we're only at step 1. Some jurisdictions have moved to step 2. I think from my response to that, you can glean that I would say to people it is too early to be booking that sort of holiday. You may, there will be an opportunity with time to consider where your vacation is and whether cruise ships are the right place to go, but I would suggest that that's too early at this point in time.
So we do have to exist with COVID-19. The World Health Organisation has some good and some bad news just in terms of doing just that.
Yes, well, look, the bad news is that a warning from Dr. Mike Ryan, who is the Director of WHO Emergencies, has said that, and I'll give you this quote because it's quite important. It's important to put it in this on the table. This virus may become just another endemic virus in our community, and this virus may never go away. In other words, we may never have a cure for this. We may never find the jab that can protect us all, and we may have to learn somehow to live with this virus as we've learnt to live with other viruses. So that's rather disturbing. However, let me give you some good news. I don't want to end on a downer.
Please no, we won't.
Let's have a look. Let's have a look. Have we got the picture there of Maria Branyas? Can we get her picture up there? Because she is 113 years old. She is probably the world's oldest sufferer of coronavirus, but she's come through it. She's survived it. She's Spain's oldest lady. And just consider this, that she was 11 years old when the Spanish flu went through the world, and she survived that back in 1918. And here she is 100 years later, and she's survived COVID-19. So what she is a stayer. She's an example to us all. Doesn't matter how old you are. Sometimes you can just get lucky, and clearly she has been.
Yes, indeed. Phil, we do need to see those stories. Thank you for bringing it to us.
Pleasure.
Service New South Wales says it's been the target of a cyber attack that accessed data in staff emails. The organisation says the emails of 47 of its staff members were illegally accessed last month. Forensic specialists are working to determine the scope of the attack on customers' personal information. Service New South Wales says it will be contacting customers who may have been affected by the attack. WA's highest court has overturned the conviction of a man who's been fighting for 13 years to clear his name of the murder of his pregnant girlfriend. Our reporter Joanna Manar joins us now from Perth. Good afternoon to you, Joanna. What is alleged to have happened, or what was alleged to have happened in this case?
Well, this case dates back to 2007 when the body of 34-year-old Stacey Thorne was found outside her Boddington home. She had been stabbed 21 times. Now, it wasn't long before her boyfriend, Scott Ostick, was arrested and charged with her murder. Stacey Thorne was 22 weeks pregnant, and it was alleged that Mr Ostick wanted to murder her because he didn't want her to have the baby. He stood trial 2 years later in 2009 and was found guilty of her murder and sentenced to life with a 25-year minimum. His appeal to the Court of Appeal in 2010 failed, and it wasn't until 2018, after he had petitioned the State Attorney General about concerns about some of the evidence in the case, that the case was referred back to WA's Court of Appeal. It heard that last July, and today it ruled that his conviction should be set aside and a retrial ordered.
Can you give me some more details about that? On what grounds exactly did he appeal against his conviction?
Well, there were suggestions, allegations that some of the key evidence in the case might have been planted. For instance, there was a concern about a bloodied cigarette pack that was photographed on a table inside Mr Ostick's home. Now, that cigarette packet wasn't there in the initial photos that were taken at Mr Ostick's home and in an initial scene video, but it did appear in photographs that were taken 30 hours later. So there was a suggestion that that was put there by police. There were also concerns about a Jim Beam can that had alleged to have had Scott Ostick's DNA on it, that was found on a verge, and it was suggested that that might have been placed there by police. There were also questions about the knife that was alleged to have been the murder weapon. It was found 3 days after Stacey Thorne's death in a paddock. That was despite State Emergency Service volunteers having searched the same area 3 days earlier. Now, the detectives said they just looked down and saw the knife, but a forensic pathologist testified at the appeal that he didn't think it was likely that that knife was the murder weapon. And that was because the blade of that knife was 10 centimetres. Yet some of the injuries on Stacey Thorne measured between 13 and 14 centimetres. So there were questions about whether the weapon that was alleged to have been used was the actual murder weapon. Unfortunately, we don't exactly know the reasons for the Court of Appeal's decision. They were suppressed, and that's likely because of the retrial that is pending for Mr Ostick.
Joanna, has Mr Ostick been released from jail in the meantime?
No, he hasn't. He's still behind bars. He can only be released when you're on a murder charge by the order of a Supreme Court judge. His lawyer, Clint Hampson, did anticipate that they would be making that bail application next week. He's already spent 13 years in custody and he's still got 12 years to go. But they are hopeful that he will be released. And one of the reasons for that is because, of course, as with many states around Australia, jury trials and proceedings in courts have been halted by the coronavirus pandemic. So it might be a long time before he gets another trial. So that would be certainly an issue that's likely to be raised when he does make a bail application.
Joanna Manar in Perth, thank you. A 4.3 magnitude earthquake has been felt widely across South Australia. Our reporter Shubha Krishnan joins us now from Adelaide. Good afternoon to you, Shubha. First I have to ask, did you feel it?
I didn't feel it, unfortunately, Kirsten.
OK, so what do you know about this earthquake? When did it happen?
So it occurred at about just before 3:30 local time, so just about an hour ago, and it occurred between Clare and Burra in the state's mid-north, so it's about an hour away from Adelaide, and as you mentioned, it was a 4.3 magnitude quake at a depth of about 3 kilometres, so pretty shallow, and as you mentioned, it has been widely felt. Geoscience Australia says they've had more than 300 people report in saying that they felt the tremor. It's the largest quake in the area within a 100-kilometre radius in the past 10 years. The second largest quake in that sort of area around Jamestown was in 2011, and that was a 3.8 magnitude quake. So hearing reports of 10 to 20 seconds of shaking, no reports of damage, but that's pretty unlikely with an earthquake like this.
OK, Shubha Krishnan, thank you. A public school in Sydney's West has shut down today after a staff member tested positive for coronavirus. Husnia Shams reports.
Staff and students here at Warrington Public School in Sydney's West have been told to stay home today. The school's been closed for cleaning after a staff member here was diagnosed with coronavirus. Now, the Department of Education says that it's contacting all staff and students who had close contact with this worker, and they're being told to self-isolate. Authorities are also looking into the source of the infection. Now, schools in New South Wales only just began a return to face-to-face teaching on Monday. Under that phased return, students are going back to school for at least one day a week. And Premier Gladys Berejiklian says she expects more school closures in the coming weeks.
We should accept that this is going to occur frequently in the next little while. We have to accept that there will be circumstances where a teacher or other person in and around a school community acquires the virus. What is important is that we act quickly, and we have a procedure in place, which we do, to make sure that we protect all the contacts and protect that school community. So we should expect what we've seen happen at Warrington overnight, or in fact at Warragamba last week, to become a frequent occurrence.
The New South Wales government says it hopes to have all students back at school by the end of May as part of its easing of coronavirus restrictions. Now, some of those restrictions are being relaxed tomorrow, when outdoor gatherings of up to 10 people will be allowed. People will also be allowed to have up to 5 visitors inside their homes. Meanwhile, restaurants and cafes will be allowed to reopen, with up to 10 people allowed to dine in, as long as they adhere to social distancing requirements. That rule also extends to pubs and clubs, which will also be able to open up their restaurants. The Premier's urging people who plan to visit venues tomorrow to maintain social distancing and avoid queues.
Victoria has recorded another 9 cases of COVID-19 overnight. 2 are household contacts of staff from a McDonald's restaurant in Melbourne's north, where an outbreak is now linked to 8 cases. Zalika Rizmal reports.
Victoria has recorded 9 new cases of coronavirus overnight. Now, of those 9, 3 are close contacts of known cases, including 2 linked to the Fawkner McDonald's outbreak, which now has grown to 8 people. Now, that includes 4 workers and 4 of their family members. We've also got 3 returned overseas travellers currently in hotel quarantine, also returning positive tests, as well as another 3 employees from Cedar Meats. Meads. Now that cluster has grown again with those new numbers to 90. 64 staff have now been confirmed to have been infected, as well as 26 of their close contacts as well. Now this week we've heard some debate about how the Victorian Health Department has handled this cluster at Cedar Meads, and in particular about the timing of the closure of that facility. Today we heard from the Victorian Chief Health Officer, who appeared on 3AW radio this morning, where he responded to some of that criticism. Now he said that the Victorian Health Department could have reacted differently to this outbreak, and admitted that perhaps they should not have waited until that third positive test before they closed the facility. Meanwhile, the Victorian Government has maintained its support of the Health Department and of the Victorian Chief Health Officer, emphasising the dynamic, difficult and unprecedented situation which they are faced with. Here is what Senior Government Minister Jacinta Allen had to say on the issue a short time ago.
We need to also remember that our health teams are working 24 hours a day, 7 days a week on giving the best advice to the government and the community. They're doing a tremendous job, and it's entirely appropriate that the Chief Health Officer acknowledges that they're working hard to learn the lessons at the same time as working with the community.
Now today, Cedar Meads has confirmed that from next Monday it will begin a staged reopening of the facility with the advice and support of the Victorian Health Department.
Going to school in WA will be compulsory from Monday. Attendance at public schools is already up to more than 85%, and from next week home learning packages will no longer be issued. The Premier, Mark McGowan, says it's time for students to get back into the classroom, and that only children who are medically vulnerable or who live with a family member with a chronic illness will be exempt.
From Monday, students who remain away from school without this exemption will no longer be provided with learning packages, and their absence will be marked as unauthorised. In short, it's time for all West Australian students to go back to school and go back to the classroom.
With the focus on coronavirus, there are fears thousands of cases of other diseases like cancer will go undiagnosed and untreated. Doctor visits have dropped dramatically. Experts are warning the health system could be hit by a wave of disease in the next year. Medical reporter Sophie Scott has the story.
Former politician Jim Lloyd is now fit and healthy, but when he was just 48, he was diagnosed with prostate cancer. He gets a referral for a blood test each year to make sure it hasn't returned.
That turned up in the post literally, the middle of March, and it was right at the start of the pandemic, and I thought, oh, look, I'll get around to it, and I just put it on my desk, and that's where it sat, really.
Cancer experts are worried many others are putting off their tests too.
We are concerned because the latest data indicates that there is a 60% reduction year on year in the numbers of men who are presenting for a prostate-specific antigen test, a PSA blood test, which helps us diagnose cancer. And this is a terrible statistic.
During the COVID-19 pandemic, you might be putting off seeing your doctor, but that's not a good idea.
A new campaign is urging people to get screened, saying as many as 7,000 cancer cases could go undiagnosed.
The risk of contracting the virus is there and real, but you can take precautions to prevent that. But you can't fix cancer yourself. You really do need the assistance of your GP and the specialists that will look after you.
Doctors are worried people with chronic conditions like asthma and diabetes are also going unchecked.
If you do wait for a very long time, it may actually go from being a treatable condition to an untreatable condition. General practices are safe. They're probably safer than going to your local supermarket.
What we don't want to see is a tidal wave of new diagnosis 12 months down the track.
Jim Lloyd knows the importance of screening.
I think I'm pretty typical of most blokes. We really don't like going to the doctor, and it doesn't take too many excuses for us to put something off.
He's going to get his blood test this week. Sophie Scott, ABC News.
Now, Phil Williams mentioned it a little earlier in this bulletin. The World Health Organisation's emergencies chief has declared the coronavirus may never go away. Dr Mike Ryan made the remark while warning against trying to predict when the virus would disappear. Tony Blakely is Professor of Epidemiology at the University of Melbourne, and he joins me now. Good afternoon. to you.
Good afternoon.
We are only several months into the pandemic. Is the World Health Organization jumping the gun with this comment?
No, I think they're pointing out an unfortunate reality is that for countries who don't eliminate, and it looks like Australia won't, certainly Victoria and New South Wales won't, we are moving into a phase where we're going to have low grumbling infection rates there, and it's going to be a long haul. And with those low grumbling infection rates, we'll see what we're seeing in Victoria, for example, with an outbreak at an abattoir, outbreak at McDonald's, and then school outbreaks in New South Wales. That, unfortunately, is our new normal.
Could this statement, though, have some significance in terms of whether we will ever find a vaccine for COVID-19?
That's the big question. So the best scenario that Australia's got at the moment is we grumble along for 18 months to a vaccine, we get vaccinated and we're back to normal, and between now and then we're somewhat normal. If a vaccine is a long way away or never happens, then that's a completely different game, and we will need to learn with the virus to live with it in a way that we didn't quite want to, and allow it to basically become part of our normal fabric, whereby we see herd immunity achieved somehow. But that's at least a year down the track. In the meantime, it's about suppressing it, keeping levels low, and waiting, hoping for that vaccine to arrive soon.
Can I ask, are you aware what kinds of pressure is the World Health Organization under when it comes to making statements about the future of an illness, given the economic havoc in particular that we are seeing around the world with this one? Governments are now under all sorts of pressure to relax restrictions. Does the World Health Organization feel obliged sometimes to react a certain way as well?
I can't speak for the World Health Organization, but I did see the interview that Dr. Mike Ryan gave where your comments come from today, and he made a very good point in that. He said that this is not the economy versus health. The idea is that you try and get a level of that virus with your health system coping with it where you don't have to lurch into and out of lockdown. That's the real fear here, is that we may lose control of the virus and be back into lockdown, then out again, back again. That would be very unstable for the economy. We need to learn to find a way where the health system works and gets the level about right, which allows the economy to tick along at some form of new normal. It won't be completely back to normal, but some form of new normal.
And so that said, taking a look at Australia's situation again for a moment, we have a state-by-state approach right now with major clusters in a couple of states. Do you think that state-by-state approach should continue with borders closed until these outbreaks are brought under control?
Let's put the borders aside. I think given we've got a lot of variation across Australia, it is appropriate for different states to be doing different things. So, for example, in your item about 3 or 4 minutes ago, WA is requiring all kids to go back to school. Entirely appropriate for them. Probably not quite appropriate yet for Victoria, say, as we're still trying to get on top of these outbreaks. So that diversity, whilst it can be frustrating at times and you might get some odd decisions from time to time, I do think that's actually a strength that Australia's got going forward, with strong direction from federal level, which we saw last week with the menu of how to go for a 3-step process to try and get back to somewhat near normal provided by central government.
The New South Wales Premier Gladys Berejiklian has said today she would like those borders, though, that have been put up by different states to come back down to allow travel interstate. As an epidemiologist, do you think that is wise at the moment?
That's a big decision. If we open the borders up, we are accepting that we're doing this together. Now, the one really interesting state at the moment is WA. They may have eliminated, as may have New Zealand. Can't quite call it yet, but if they do, then WA's got a really interesting situation. They could keep the borders locked and get back to a more normal, new normal, but they'd have to have very strict border control. So I think that's a really interesting one to watch as to how WA approaches that. Say New South Wales and Victoria, given we seem to be in a reasonably similar position, assuming we're both going to accept we're living with the virus somehow, opening that border up would seem more sensible to me, at least.
All right, Tony Blakely, really interesting to speak to you. I hope we get many more opportunities, since it does appear as though we will be living with this for a little while longer.
We will indeed. Thank you, Kirsten.
Well, New Zealand has moved into its next stage of reopening. Shopping centres, clothes shops, cinemas, hairdressers, massage parlours and restaurants are all open for business. TVNZ reporter Paul Hobbs has more.
I'm out at one of Auckland's popular restaurant districts, Ponsonby, where businesses are celebrating the end to a 7-week lockdown, 7 weeks of no trading, and they're reporting brisk business. They're saying tonight that they are pretty much full, although they are operating at just 75% capacity for most of them due to the social distancing restrictions that are still in place. Shops, cafes, gyms and hairdressers are back in business, and that's great news for retailers who have seen the tills ringing for the first time. And there were queues outside a number of the shopping malls as people came racing in trying to make their purchases and spend that precious money. New Zealanders have been pretty patient through this 7-week lockdown period, and they feel that they have done their bit to get the COVID cases and the deaths down to as little as possible. And now they just want to see a return to normal, what we call level 2 normality.
The British Chancellor says the UK is already in a significant recession after the economy shrank in the first 3 months of this year. Rail unions have threatened to stop train services after commuters crammed into public transport across London on the first day of eased coronavirus measures. Europe correspondent Samantha Hawley reports.
Forget mind the gap. Now mind each other. Boris Johnson ordered them back to work and they listened, thousands of them.
You can see people are more packed, and if there are people who are still carrying the virus, they're transmitting, obviously it's not nice.
It's a lot busier than what it was a couple of weeks ago, but I'm finding it's getting busier and busier each day.
The government urged workers to avoid public transport.
I don't want to see crowding on mass transit, public transport in our capital or anywhere else.
An impossible ask for many. As the British capital came back to life, the death toll passed 33,000. Amid demands, Boris Johnson released the scientific advice.
After the confusion of the last few days, gaining public confidence in them is crucial.
Our scientists and our medical officers have been involved in every stage of preparing this strategy.
As thousands of people return to work, the economy will start to tick over again. But the British Chancellor has warned the nation is already very likely in a significant recession.
With some lockdown measures now gone, all eyes will be on the infection rate. These images make it hard to see how it could fall. Samantha Hawley, ABC News, London.
Pedophile priest Gerald Ridsdale will spend at least another 3 years in jail for abusing and raping children in Victoria in the 1970s. Ridsdale has been in prison since 1994, serving a 34-year sentence for abusing more than 60 children. He pleaded guilty to 14 more offences against 4 boys between 1970 and 1979 and was sentenced to 10 years jail. His non-parole period has been extended to 2025. Police in New South Wales have arrested and charged Ricardo Barbaro over the death of a 26-year-old woman in Melbourne after a week-long search. Reporter Mark Reddy has more from Sydney.
Ricardo Barbaro was arrested at this block of apartments at Wentworth Point behind me here in Western Sydney. In the early hours of this morning, riot police and heavily armed officers made their way up to the 15th floor. They bashed in one of the doors and inside one of the apartments was Ricardo Barbaro. He was handcuffed after a scuffle with officers and he suffered minor injuries, so he was taken to Concord Hospital before being transferred to Burwood Police Station, where he underwent questioning by detectives for several hours. He was eventually charged with the murder of South Melbourne woman Ellie Price. The 26-year-old's body was found inside her townhouse about a week and a half ago, but it's believed it had been there for up to 5 days. On Friday, her car, a white Mercedes, was found about 40 kilometres away. But about a week and a half ago was when this manhunt unfolded. Victoria Police put an urgent call out to New South Wales Police and Queensland Police, and there was a big search spanning a few states. We know his white van was spotted in regional Victoria, and the public's help was really crucial to finding him here in Sydney. So he has now been charged. The process from here, though, is that Victoria Police will travel to Sydney and they will try and extradite Ricardo Barbaro back to Melbourne, where I'm sure that investigation will continue.
Time for the national weather now. Here's Graham Creed.
We've got very little change in the forecast conditions. So what you're being experiencing today will continue as we roll into Friday and pretty much across the weekend. That's because a high pressure system remains the dominant feature across most of the continent. It's centred over Victoria, but it extends all the way back into the western parts of the continent. And although a cold front's moving towards the southwest, it runs up against this high pressure system, so it dips south fairly quickly. But the high is also bringing a burst of onshore winds along the New South Wales, Queensland and the northeastern Territory coast, so that will trigger a few isolated showers. Really, Sydney is the only capital city expected to see the odd shower or two. We could see one or two about the Sunshine and the Gold Coast, but those falls will be patchy.
You can keep up to date at news.abc.net.au and on iView. Here are the top stories on ABC News this afternoon. The Prime Minister has described the release of the jobless figures as devastating. Almost 600,000 jobs were lost last month as the coronavirus lockdown hit businesses. 1.6 million people are now receiving the job seeker unemployment benefit, and more than 6 million employees are covered by the federal government's JobKeeper wage subsidy scheme. Service New South Wales says it's been the target of a cyber attack that accessed data in staff emails. The organisation says the emails of 47 of its staff members were illegally accessed last month. Forensic specialists are working to determine the scope of the breach on customers' personal information. WA's highest court has quashed the conviction of a man who was 13 years into a life sentence for the murder of his pregnant girlfriend and ordered that he face a new trial. Scott Douglas Ostick was found guilty by a jury of stabbing to death 34-year-old Stacey Thorne at her home in December 2007. Ostick won the right to a new appeal in 2018 after concerns were raised some of the crucial pieces of evidence in the case may have been planted by police. And the union representing the NRL's match officials has lodged a dispute notice with the Fair Work Commission over the decision to go from 2 referees to 1 in the NRL. The Professional Rugby League match officials believe the NRL doesn't have the option to change the officiating model during the term of its enterprise agreement, which runs until the end of 2022. Competition is due to resume in 2 weeks. The official unemployment rate has risen from 5.2% to 6.2%. The result is less than expected, but the headline hides a drastic drop in the participation rate to levels not seen since 2004. The Prime Minister, Scott Morrison, says the figures are devastating.
This is a tough day for Australia, a very tough day. Almost 600,000 jobs has been lost. Every one of them devastating for those Australians, for their families, for their communities. A very tough day. Terribly shocking, although not unanticipated. We knew there would be hard news as the pandemic reaps its impact on Australia, as it is on countries all around the world. And so it has been the case. And in the months ahead, we can brace ourselves and must brace ourselves for further hard news for Australians to take. But it's important on a day like today that we remember to support each other again, but also to seek to take heart and to encourage each other in hope. Almost 600,000 Australians losing work can disappoint that hope. It can break hearts. But as important as a country that we stand firm and we stand together. The plan that the government has been pursuing from the outset of this outbreak has been to fight this war on two fronts: to fight the virus and to fight the economic devastation that the virus brings. It has always been a battle on each of these that has been critically important. On the virus, of course, we've made great progress. We're winning, but we have not won. When it comes to our economy, we anticipated that this would be the impact. And so we did not wait to put in place the economic support and lifelines that would be needed. This was done many, many weeks ago, and at record levels, with both the expansion of JobSeeker to support those who could not stay with their employers. And for the first time for so many of them, they would seek unemployment support, or indeed the JobKeeper program, which is doing exactly that, keeping people in their jobs. A program of a scale this country has never seen before, and I hope never has to see again, to respond to such a weighty economic blow as we've seen occurring in these recent months.
More than 590,000 jobs were lost last month as coronavirus restrictions hit businesses. Shadow Treasurer Jim Chalmers says too many workers have been excluded from government payments.
The government desperately wants Australians to believe that everything was perfect in the economy and then along came the coronavirus. But underemployment has been an issue which has hung around for too long. It's been turbocharged by this crisis. Unemployment and underemployment will be worse than it needs to be because the government's taken a good idea in JobKeeper and badly implemented it. Too many Australians are heading off to Centrelink as a deliberate consequence of the government's decision to exclude them from the JobKeeper program.
A new survey by the CSIRO shows most Australians don't know the difference between viral and bacterial infections, with some people mistakenly believing that coronavirus can be treated with antibiotics. The research was done to support the call for a national antimicrobial resistance project called Outbreak. In a world first, the program aims to use artificial intelligence to predict superbug outbreaks and stop them before they reach the health system. Associate Professor Bronwyn Morgan is Outbreak CEO at the University of Technology, Sydney, and she joins me now. Good afternoon to you. Firstly, were you surprised by these results?
Good afternoon, Kirsten. Yeah, there's a few results in the survey that were particularly surprising. One is that 9 out of 10 Australians don't actually know the difference between a bacteria and a virus. 1 in 5 think that antibiotics can be used to treat the common cold, and just over 1 in 10 think they can be used to treat coronavirus. So these are pretty high rates.
How about by the revelation that it appears some Australians are being given antibiotics for viral infections? And I wonder, do GPs still have some improvement to make in that area of prescribing?
So we do know that Australians globally are one of the highest users of antibiotics, but of course the challenge for our clinical experts is to quickly determine if an illness is due to a bacteria or a virus and whether or not antibiotics are really required. Now, what we do know is that secondary bacterial infections are quite common, and we've seen this with COVID-19 as well, and do cause additional treatment complications. I think the real worry, though, is that, we found a third of Australians have actually asked their GPs to give them antibiotics.
Now, the federal government already compiles this kind of information. You've been doing it also to support your call for the resistance project that you're leading to find for a national antimicrobial resistance project. Can you tell us about it and how you hope that artificial intelligence will be able to predict outbreaks of superbugs?
Sure. So we're funded through the Medical Research Future Fund Frontier Grant. We've been funded for the last year, and there's 14 organisations that are part of our consortium. CSIRO is obviously one of our major members. So what we've really done is look at what exists and what needs to exist. So most of the information we have on antibiotic resistance comes from the healthcare sector. And we know there are huge data gaps, but also huge time lags in getting that information. But antibiotic resistance isn't a problem confined to healthcare settings. It's a One Health problem. And that's because we live in a world where everything is connected, from the food we eat to the pets we play with and the waste we produce. And our animals need antibiotics too to keep them healthy. So we need to have all the data that comes from all these different sectors together in an integrated system. And that could be data that we generate within the consortium, which is down at the DNA level, or also collecting and making use of the data that's already out there, because there's no point collecting data once and using it once. You want to be able to use it many, many times. And there are huge gaps in knowing where the next superbugs or drug-resistant infections are going to come from. So we need to work together to tackle this problem. And that's what we're doing with the Outbreak Project, is we're bringing these disparate data sets together to create a high-tech early warning system to develop a location-specific and person-specific threat of a drug-resistant infection.
When you talk about compiling different data sets, are they all from official sources, say in a health setting, or is any of this information that you're looking at and interested in, does it come from people's own phones, for instance, perhaps what they're actually searching for in a search engine if they're feeling unwell?
That is something we're looking to in the future, but at the moment, a lot of the data does exist and is out there. There's obviously strict regulations around being able to access some of this data, and we were thrilled just a couple of weeks ago when our very large ethics approval came through. So we can really start to do some of the data linkage studies now. But importantly, because some of this data doesn't exist, we have some of the leading genomic and bioinformaticians within our team, and they are generating new data, and they're using new technologies to track at the DNA level what's being passed where. Because unlike this particular virus, let's say SARS-CoV-2, antibiotic resistance or antibiotic-resistant bacteria, it's not one bacteria, it's dozens of bacteria. And they are literally passing bits of DNA, or if you think of it, luggage, between each other to become drug-resistant and more virulent. So we really need to understand at the biological level how this is occurring and build all that information into our system as well.
Bronwyn Morgan, really interesting speaking to you. Thank you.
Thank you very much.
South Australia has recorded the highest unemployment rate in the country, rising to 7.2%. More than 40,000 people lost their jobs in the state last month. That's according to ABS data out today. Premier Stephen Marshall says it will take time for the jobs market to recover.
One of the things that we're really keen on the National Cabinet to address is getting people back to a COVID-safe environment by July. And that really is the time when we hope to have more and more hours worked right across the country. We know that JobKeeper is in place until the end of September, and that's a great support. But we also need to open up employment right across the country, but we've got to do it in a way that is safe. Most importantly, we've got to do it in a way that is sustainable, so that we're not releasing the restrictions, having a flare-up and then having to pull those restrictions back down in place. Business have told us this would be an absolute disaster, and we know it would be a body blow in terms of confidence across the nation. The reality is we would like to get business and we would like to get a whole range of aspects across community stood up as quickly as possible, but we've got to do it in a safe way, we've got to do it in a sustainable way.
Well, while today's unemployment numbers weren't as bad as forecast, worse is expected to come. Treasury still expects the figure to reach double digits by June, and Australia's biggest union, the ACTU, is also bracing for a higher number. For more, we're joined by the presenter of The Business, Rachel Papazoni. Good to see you, Rachel. Today's jobs numbers weren't as bad as the economists had feared, but do they reflect the full gravity of the situation at present?
Well, so when you sort of drill down the numbers, that's where we get a better reading of the situation that we're facing. So 600,000 jobs lost, the unemployment rate up 1% to 6.2%. That's lower than what many had sort of forecast. But for some perspective, that figure of 600,000 jobs disappearing in the month, that's 8 times more than what we saw at the peak of the last recession for a monthly figure. So that gives a little bit of perspective perspective. But when we look at the number of people looking for work, that dropped to the lowest figure we've seen in generations. The number of hours worked, that's also fallen. So people, as we know, aren't working as many hours as they want. And of course, we have the JobKeeper wage subsidy, which means that people who are employed but not employed kind of category are not really picked up in these figures. So we've got 1.6 million people on job seeker, 6 million people on JobKeeper. So those numbers perhaps are more reflective of what the real situation is for people out there whose jobs have been impacted by this health crisis. Tonight on the program, I speak to Sally McManus from the ACTU. Now, they represent 1.6 million workers nationwide. She was agreed that the numbers were better than expected, but as you said, is bracing for more to come.
It shows how effective JobKeeper has been in stopping the mass unemployment that we're seeing in other countries, and certainly we would have had in our country without it. I think the estimates are that unemployment would have been 5 points higher if it were not for that. The other thing that's happening, of course, is that a whole lot of people just aren't looking for work, so it's not showing up in the stats for obvious reasons. I mean, if you're a hospitality worker, there's no point trying to look for a job there at the moment. And the other thing that's happening is a big increase in underemployment, and we really see that right across the economy in all different sectors. Employers have opted to cut hours rather than let people go, which is a better option actually at the moment. So if you put underemployment and unemployment together, it's about 20% of the overall workforce. So it's a big figure, but it could have been much worse.
And is it clear which sectors fared more poorly than others?
Yeah, so perhaps not surprisingly, we've seen older people, women and younger people more impacted by the economic crisis that we're in. So when you look at the participation rate, which is the number of people looking for work, we've seen the discrepancies most evident with older workers and women. Also for women, a bigger number of those, that group of people have got less work. So because they're more likely to be in sectors that have been hardest hit, like hospitality, tourism and retail. And when it comes to youth unemployment, that rate went up twice as fast as the overall national rate. So we're seeing a real divide here between who's been impacted in terms of their job status, mostly by this crisis. So we'll go into all that detail on the program tonight.
Okay, we'll look out for you then. Rachel, thank you. The Foreign Minister Maurice Payne says the attack on a maternity clinic in Afghanistan was pure evil. 2 babies, 12 mothers and a number of nurses were gunned down in an attack on a Kabul hospital maternity ward. A separate attack by a suicide bomber killed dozens at the funeral of local police commander. Islamic State has claimed responsibility for one of the attacks, and Ms Payne says Australia supports the international community's attempts to bring the perpetrators to justice. Hundreds of pro-democracy protesters jammed shopping malls across Hong Kong, defying social distancing rules. Riot police clashed with crowds and used pepper spray on demonstrators. They had gathered to protest against the rule of the territory's chief, Carrie Lam, on her birthday. COVID-19 restrictions had previously limited unrest. The Indian capital is home to millions of street animals that rely on food scraps and volunteer feeders to stay alive. During the nationwide lockdown, many cats and dogs have been abandoned by owners over fears pets could spread coronavirus. South Asia correspondent James Aiken reports.
Whenever Sonia Ghosh is on the move, several dogs are often in tow.
Yeah, people call me a dog mother.
The volunteer feeder has been helping street animals for as long as she can remember. Every day she digs into her own pockets to buy ingredients to cook up meals for dogs. And the occasional cat. But her work is in more demand than ever before.
We are working approximately double the time.
These puppies are just some of her newest friends, discovered after they were kicked off a farm.
I'd say hundreds, if not thousands, of animals, companion animals, have been added to the streets of Delhi alone, looking totally confused and betrayed by their owners because of some ridiculous rumours that are going around saying that coronavirus can be spread by companion animals.
Hi everyone, this is Vijay Eshudas.
The problem got so out of hand, celebrities have been taking to social media to help stop the spread of misinformation.
And do not spread rumours and do not take part in it.
The fight for animal welfare started early in the lockdown when volunteers teamed up with police to rescue animals left starving in abandoned pet stores.
We got the veterinary hospitals and services to be open, at least for emergency services, because that was a crucial gap.
The price of dog food has gone up considerably under the lockdown. This, combined with a drop in donations, has meant feeding these dogs is harder than ever before. Regardless of the challenges, Sonia Ghosh remains committed.
Well, I feel that I've achieved something.
A good deed in a rough time. James Overton, ABC News, Delhi.
Now for the day's sports news, Jared Coote joins me again. Hi Jared, what is the latest on the NRL's flu vaccine issue?
Well, we know that they had 2 players left, the Gold Coast Titans, that is, who had not had the vaccine. That has now changed. Brian Kelly decided to have the vaccine earlier today so he can train and play with his teammates. Great news for the Titans. Bryce Cartwright, well, he's a different story. He's probably the most high-profile player that opted not to get the vaccine. We know he's been anti-vax for quite some time. Quite a hefty contract as well, $450,000 a year. So there's a lot to think about for Bryce. Today is the deadline for him to make a decision. So we'll have to wait and see what he ends up deciding there. There is some reports that he is considering doing a bit of a backflip to ensure that he can get paid that contract money, whether there's a legal issue and whether he can actually be sacked by the Titans for not training. That's another story in itself, as opposed to a couple of rule changes the NRL has introduced. The one referee, it's official, the Commission has locked it in, so there's no turning back for this season at least. We know it's a cost-saving initiative. A lot of fans aren't happy with it because that second referee certainly patrols the ruck, which is crucial in the game at the moment. The ruck speed almost one of the single biggest reasons as to how teams can dominate. A lot of criticism about the Melbourne Storm dominating in the ruck, so we'll have to see how that plays out again. The referee can also call for a 6 again now as well instead of awarding a penalty. The point of that, just to keep the game flowing and keep it rolling along, but I can also see a number of the teams using that to their advantage as well. So we'll have to see how the teams choose to get around that rule. We know NRL teams love to flout the rules as much as they can, push some boundaries, we should say. It's also worth noting that the referees are now looking at some strike action over the fact that they've moved from the 2 to the 1 referee. That was brought up last week. They denied it, but now it looks like they are going to go ahead with that strike action. That may then impact the May 28 start date for the NRL. Just another nightmare, another hurdle that they've been dealing with all the way along for the past couple of months. We also know the NRL draw is set to be released tomorrow, well, at least the first 2 rounds. The Roosters-Rabbitohs, the biggest rivalry in the game, is set to be a part of that as well. So that'll be great tomorrow, but only 2 rounds. The clubs were hoping for a full draw, so I'll have to wait and see.
So that's the NRL. Is it becoming any clearer when the AFL season might resume?
Well, we're getting more pieces of information, but everything's pretty unclear at the moment. The AFL set to announce their return to play plans tomorrow, which was interesting for them to do. We thought it was going to be today, but they've been delayed. That was mainly because the South Australian government denied the clubs the opportunity to bypass the 14-day self-isolation period, which they weren't expecting. So a bit of a blow for them. We know over in the West Coast and Fremantle have granted exemptions to train in WA. That'll be on the 18th of May. Then can then go into some full contact training on the 25th. They're looking at June 11 as a possible start date, the AFL, but we'll find out that for sure tomorrow. The 2 WA and 2 South Australian clubs, we believe, will be sent to South East Queensland into some hubs. It was up to the AFL to decide where they go. So interesting that the AFL has to say, whereas in the NRL it's often up to the clubs. WA Premier Mark McGowan, he says, well, he's happy to have an AFL hub in Perth. He said, why not just bring them over here? He called the Victorian clubs pampered, which I'm sure didn't go down very well over there. But let's hear from the Port Adelaide football manager, Chris Davies, who was talking about the restrictions put on them by the South Australian government. We know the Crows had a bit of trouble. They weren't isolating properly, not distancing themselves from one another, and he had a little bit of crack at them.
I don't think that even the staunchest Crows supporter would believe that it's had a positive impact. Look, I think we said all along that the club would follow the SA Health guidelines, and so on that basis, we understand that the decision that has been made overnight, obviously it doesn't change the fact that we're disappointed with the potential for us to have to go interstate. But we acknowledge that South Australian people's health needs to come first.
In terms of clarifying future plans, Dan Ricciardo is hoping his F1 future plans might come into shape later today.
Yeah, that's right. Looks like he could be off to McLaren now, replacing Carlos Sainz. We know that Sainz is set to join Ferrari. This all happened, of course, because Ferrari announced that Sebastian Vettel would be leaving the team at the end of the year, created a bit of a domino effect. So plenty of chat around Dan Ricciardo. We know where he is at the moment at Renault, hasn't had the greatest of results. So you imagine that might change somewhat at McLaren.
Thanks, Darren.
Thank you.
Time to check the weather now with Graham Creed.
A high pressure system is the dominant feature and it will remain that way as we move through the weekend. It is going to bring the potential of some fairly widespread frost through parts of the southeast, although the winds will probably remain a little bit too strong for widespread frost in Tasmania. The high will also bring onshore winds along the Queensland coast, so the Sunshine and the Gold Coast could see an isolated coastal shower, a little bit more likely up around the north-eastern tropics of the state. And for New South Wales, it's the coastal fringe anywhere north of about Sydney, looking at the potential of those showers. We are expecting to see mostly dry conditions across the remainder. And for Melbourne, we're also looking at some fairly widespread frost tomorrow morning. Mostly dry and sunny conditions across the state, and there is a pretty much statewide warning for frost tomorrow. We've also got a cool start for Tasmania. The potential of an isolated shower mostly about the west and south of the state, possibly one or two around the Bass Strait Islands. We're looking at a dry day across South Australia, perhaps a little bit of cloud about the southern parts of the peninsula. We're also looking at some patchy frost on and east of the ranges. For Western Australia, there's a weak cold front moving towards the southwest. Now that will see an isolated shower about the far south of the west coast and also the far west of the south, the south coast, I should say. For the Northern Territory, a few isolated showers about the northeastern corner and perhaps an isolated morning shower about the Tiwi Islands.
Thanks, Graham. Remember, you can keep up to date at news.abc.net.au and on iView. Top stories next with Andrew Gagan. Do stay with us here on the ABC News channel throughout the evening. I'll see you again tomorrow.
Tonight, Barry sits down with Richmond's club president Peggy O'Neill.
When you first joined the board, there weren't a lot of women.
It is improving.
To talk loyalty and leadership.
Sacking the coach was not the answer.
You won the premiership.
Told you so. Your legacy is nobody notices when